Nikki is going to present Painless Journal, which is a symptom tracking app for people with chronic illnesses. So, Nikki, welcome on, and good luck. Go for it.
I'm Nikki, working with Laura and Fiza on Painless Journal. Imagine living every day in constant stiffness, severe pain, and debilitating fatigue. This is a normal part of life for Mary. Mary developed inflammatory arthritis when she was just 30. And though Mary's name has been changed for privacy, she is a close family member of one of our founders. And Mary is not alone. In the US alone, it is estimated that over 50 million people suffer from arthritis. But Mary only gets to visit her specialist twice a year. Each time she has an appointment, she has to remember everything about her arthritis, medications, and surrounding conditions from up to 6 months ago. This is hard. Human memory isn't exactly reliable, which is why when surveyed, over half of people with chronic illness regularly track symptoms, with over 80% relying on text-based formats such as pen and paper or basic text editors. This process is more time-consuming, less consistent, and makes any data analysis next to impossible. Data quality can be poor and key insights easily glossed over. This makes it difficult for doctors to make the right decisions for people like Mary. After interviewing doctors and people with chronic illness, we realized that there's a pressing need to make monitoring chronic illness easier. This is why we developed Painless Journal. Painless Journal makes it easier for people to track their chronic illness. It is a better way to track chronic illness that is not only simpler for users, but more powerful. Users can quickly track symptoms such as pain, fatigue, or health factors such as exercise. And with the cleaner, higher quality data, doctors and patients can gain a superior insight and give better decisions for treatments for people like Mary. As a for-profit social enterprise, we've decided on a two-stream approach. Individual everyday users would download the private, free version of the app, while users in clinical trials would download a different version that will allow pharmaceutical researchers to gain valuable, clean data. In just 6 weeks, we've developed a user-built app, which is live on both app stores with already over 30 beta testers. Now, I'd like to introduce you to our team. I'm Nikki, a physicist who's represented Ireland in international Olympiads. Fiza, bringing strong programming experience, and Laura, an award-winning problem solver who has personal experience with chronic illness and a strong vision. This has been done with the help of our mentor, Amy Louise, who's the founder of Keep Appy. Our ask for you today is to give us introductions to pharma and give us mentorship on sustainable business growth so we can bring Painless Journal to its full potential. We've already gotten 30 people helped so far, but now we'd like to help people worldwide, people like Mary. Thank you.
Fantastic. All right. Great job, Nikki. We'll welcome Isolt on now and Laura Cosgrave. It's worth noting as well that Fiza is she's not able to join us today, but Fiza is one of our international participants. She's actually taking part from Hyderabad in India. So Isolt should be just joining us now, and Laura Cosgrave is in the other room. It's the rest of the participants who you see joining in are down the other end of the building here. Isolt, you're with us. I think, can I hear you? There's on a bit of delay, so it might take a few seconds to come through and line everything up here. Hey, Isolt, can you hear me? All right, so we have a delay. We've got this is our first time. We're running a sort of hybrid event. Normally what happens is we have everybody up on stage, and there's stage and presentations on the stage and people in the audience. So we're figuring out how to make sure this works right. People tuning in from different setups. In the meantime, do you want to talk through, this is live on the iOS store and the Play Store right now?
Yes, so it's been live as of last weekend on both iOS and Android.
Fantastic. Great. Isolt, are you able to hear us now? No. Hey, maybe we can bring up James. Do you want to join up? If James Walton is around, we could bring up. Who have you tested with, or how are you getting started with testing?
So our main streams of getting beta testers have been through online communities, through places such as Reddit, through the arthritis forums, or through Facebook, such as the Irish group for people with arthritis.
Yeah. Hey, James, pulling you in here too. How are you?
Hopefully Iso can take over. First off, amazing work, guys. That looks incredible. And it's such an interesting problem space. And as you show, like it seems to have like mass potential with, like, as you said, like 50 million in the States alone. So I suppose my first question is, how did you decide what data points to track and what is important information in this?
So the information that people need to track is very, very variable. And this is something that solutions that are currently there haven't addressed very well. So depending on the person, they're going to need to track a whole variety of different things. So much, almost an infinite list of possibilities. So we've allowed it that you can customize and add whatever you want. So no matter if you like the most obscure thing that you need to track, you can track whatever.
Nice. And it seems that the persona you've been targeting first is people with arthritis. Have you identified other domains or other types of ailments where this could make quite an impact?
So any illness, any chronic illness, especially chronic pain conditions, will find this useful. So not only have we been looking at arthritis, but also hypermobility spectrum disorder and Ehlers-Danlos syndrome, just to name two. So we decided to have a narrow focus to start with, but this should be applicable to a wide range of conditions. I think there's 1.5 billion people worldwide with chronic pain, and this would be useful for all of them.
Incredible. That's an incredible amount of future downloads that we'll see. So then also you've got 30 beta testers now. I imagine you're probably working through the kinks and getting feedback. Once you come out of this beta period, how do you want to put this in people's hands? Are you going to partner with societies or go to different organizations? Can you talk a little bit about your envisioned growth?
So our main plans at the moment are just to continue outreaching to different communities through the internet, such as Facebook, Reddit, Twitter, or other similar platforms, and gain more information about what people really need and how data can be collected. And then once it has reached like a certain stage, then we would begin talking more with pharmaceutical companies about what their needs are for their clinical trials, so we can better fund development and even bring it to a bigger market.
And you're targeting the English-speaking market first, but let's say hypothetically you want to globalize it and add other languages. What market do you think could benefit most from this after English-speaking markets?
So although we are targeting the English-speaking market first, we actually have beta testers from Germany, for example. So really, as long as you understand the few words of English needed to access the app. But I suppose any international community worldwide will be useful, and we'll be able to globalize the app because there is quite a small amount of original language there. So it will be very easy to translate that into global languages.
All right. Sounds good, right? Well, James, thanks for the questions. And Nikki, fantastic job. And Laura, thanks too for joining in. And well done to Fizza too, who has been taking part from